Thanks. Hello, everybody.
Okay. I'm sorry about that. I think the recording thing just popped on. Sorry, Enrique.
Yeah, so many of you know, we were called the Bernalillo County Community Health Council. And that name came when we were kind of defunded by the state and became part of Bernalillo County government. So we actually had to, and I was on the board, or I don't think I was officially on the board till later. I was an unofficial kind of board member person with the council back then. But we actually had to fight the county to get community in the name, right? Bernalillo County Community Health Council. And so that was important. And we've always talked about health equity, you know, from day one, even when it was a state council, a state-funded council. And so I think that's always been there, and it's always been a part of what we were about. And so when I, you know, even becoming part of the council as a staff person was an equity issue. And, you know, I mean this with no offense, but with, you know, honesty. I was on the board, and I was supposed to be on the hiring committee for the council when the director position came open. And through conversations with folks, you know, it was just highlighted to me that I'm one of those people that always said, you know, public health leadership needs to look more like the rest of the community. And, you know, it's still mostly white folks. So I took my name off the committee, and I put my name in to be director, because I kind of got called out to stand, you know, walk my talk. And so, you know, I don't know if it was good or lucky, but here I am, you know. And so after I got there, you know, we got a new mayor in Albuquerque, and a lot of new. It's the most people I've ever known in City Hall ever, right? Because they hired a lot of folks, some public health folks and some other folks who've done community work. So I approached Family and Community Services and said, hey, can we get some funding to do some more general public health work? Because at that point, the council was focused on opioid work, either prevention or harm reduction. And so we worked through and developed a contract, and the city said, you know, we would like you to consider changing your name. And what they meant was add Albuquerque. So they wanted us to be the Albuquerque Bernalillo County Community Health Council. And we already had complaints that, you know, Bernalillo County Community Health Council was too long. So I said, sure, we'll consider changing our name. And I really didn't know where that was going to go. I just knew if all I had to do was consider it for the money, that was something I could do and feel good about, you know, because we didn't promise we would change the name either. So we just said, well, yeah, we'll consider it. So we went through a process, had conversations, and we wanted something shorter. We still wanted to have health and council in the name. And went through a variety of different things, and decided, you know, really what we're about is health equity. And we want to be explicit about that, right? It's like I said, it's been there all the time. But we hadn't made it explicit. And I still don't think we have lived up fully to the community part of the old name. So one of the things I hope that we do is, the pandemic threw us off like it did everybody else. But I hope that we actually do some real organizing, right? Because I know it was just mentioned, mobilizing is part of organizing, but some people see mobilizing as the whole package, right? And mobilizing is just transactional, asking people to do something, or it can be. And we don't want to do that. What we want to do is build relationships in community and have community, do their own leading with us being supportive. And so we're hoping that we can actually do some real deep organizing. And, and it is getting people to go to legislature. It is people going to city council meetings. But it's also, supporting striking workers like the bus drivers down in Las Cruces. Sometimes we don't make change by getting somebody to put in a policy. Sometimes we make change by stopping something. And, public health and nonprofit folks, we don't always get into that, stopping part of the economic system from functioning is sometimes what it takes to make the change we need. Whether if you want to use, more recognized examples, United Farm Workers going on strike, or, the Montgomery bus boycott, right? Those things were intended to impact economics to make change, right? It wasn't just lobbying our representatives. So I think we'll look at all of those things, right? Because at the end of the day, the premise that we're operating under is that health equity comes from social equity. And social equity comes from an equity in power and equity in resources. And so we're looking at like, what can we do in that area while, doing that delicate dance of being a nonprofit and getting funds from folks who sometimes may not appreciate that type of work in reality. So I think that's probably more than I wanted to say.
Well, we appreciate you sharing all of it. And I think that sentiment that health equity comes from a greater sense of social equity. And I think one of the, what we call bridging factors, right, between the health equity and social equity and general equity, is leadership, right? In terms of how folks have an opportunity in their own spaces to lead around their issues and connect to other leaders in other spaces doing that work. And so, as you said, moving beyond, it's not just about mobilizing, as important as mobilizing is as a part of organizing, but it's also having a deep sense of where we're trying to go, both in terms of health equity and societally. And there's always a question of access, right? There's always a question of where are their access points and how close are they to the actual folks in community, right? How difficult is it for people to access services and opportunities around leadership and even opportunities connect to mobilizing, right? So I appreciate the story. And I have one question, one follow-up for you, Enrique. When you said that old language of community and now the new language of kind of equity, that you're still working to kind of live up to both of those. Was it your experience that because you had the language to now explicitly, as you were saying, now it was explicit, equity was explicit because it's in your name. Do you feel like that's been helpful to how your work has been able to, your council's work has been able to kind of roll out? Like, is that part of the shared language been helpful, you think?
I think so. And there's other folks from the council here, they can chime in on the chat. I think it's helped us have different conversations than what we had before.
Mm-hmm.
because it's really held that up. And I think that creates a different, right? Sometimes a name really doesn't mean much. But I think in this case, we're trying to take serious living up to the name. And I think that's creating opportunities for different conversations.
Absolutely. Thank you again for being willing to share. I think it's really, it's incredibly helpful, right? To know the struggle to make the change, but then also the level of awareness that because that is in your name, equity becomes a more conscious part of your discussions. And I think that's one of the things throughout that we're going to want to, really think about is how does this idea of meeting folks where they are versus everybody getting the same thing become a part of our actionable consciousness. Each time we're having discussions and thinking about making a decision, we're asking ourselves those questions, right? How far are the folks who are from opportunity? How far away are they from the opportunity? And where is the access point? Because that is where we find some of the equity, right? So thank you, Enrique. And now I want to turn to Lauren. And Lauren, you all have been doing some work around equity as well. You haven't changed your name of your council per se, but as Ann was saying, you're doing the work and may not even have been calling it the work. So would you please share with us your story?
Sure, thank you, Everett. Yeah, we don't have the name equity or the word equity in our name. And things really look very different in Rio Arriba from when I first started working here in 1994. So, and equity means something different to us now than it meant in 1994. So when I first started working for Rio Arriba County in 1994, I was literally the first white person they had ever hired. And it was considered really strange and revolutionary. Nobody could imagine why the Board of County Commissioners did that. And at the time, people outside of Rio Arriba never bothered to hide their contempt for this community. It was not at all unusual for me to walk into a meeting being hosted by the state and have somebody there who really wasn't even from Rio Arriba claiming to represent it. Or else just, there were a number of meetings where I was shocked when somebody claiming to represent Rio Arriba started making jokes about what people in Espanola do in the backseat of cars. And that kind of stuff happened all the time. I mean, everyone thought they knew about people in this community, and what they knew was that it was very crooked, it was a dangerous place, and you'd probably get shot if you came up here, and that everybody was stupid and probably inbred. And none of those things were actually true. And so when I first started working, one of the issues we had was we were, first of all, none of the healthcare providers, the directors of agencies, and there weren't very many agencies here, were actually from the community. They were all white people from outside of the community. And they were often the people who would be in those behind the scenes meetings claiming Rio Arriba needs this or that when that's not what it needed. And we had a brand new Board of County Commissioners. And at that time, honestly, there were still pipe bombs going off in Rio Arriba because they were still people who were fighting that revolt having to do with land grants and seceding from the United States. And mostly that wasn't in Espanola. A few of them were, but not most of them. Most were in the rural areas. But, and that's probably why people were afraid to come up here, partially. But so what I'm trying to say is that at that time, the Board of County Commissioners, which was entirely Hispanic and really a brand new Board of County Commissioners that really wanted to play a role in people and improving our community. We didn't even have buildings at that time. We had no phones. I mean, we just had nothing to work with. My office was in my boss's car. I'll do it in a minute. Okay. My office was in my boss's car. And we just drove up and down the county meeting with people to find out what they wanted from county government. And so the providers in the county, those that were from the community, we could not get them to sit in a room together. There was so much discord and competition. And so at that time, what we did was the hospital needed a mill levy passed. We told them, we'll pass your mill levy under the condition that you give 10% of it to the treatment centers and to the clinics. And then we told the clinics, we'll help you get a percentage of the mill levy, but you have to help us to champion it. And we told everybody, and you all have to sit on our health council and help and become decision makers. And that's how we brought everybody together. For the first 7 or 8 years of my job, it wasn't managing funds. I think we had a total budget of about $10,000 in my department. It was literally organizing protests. We organized marches. We were constantly down at the legislature protesting. It really, what we were trying to do was that was the only way we knew of to actually get funding into Rio Arriba, because we realized back in about probably 2001, that was when it came out that we were #1 in the country for heroin overdose deaths. And we, after looking at the data, realized that what had happened was that we had a number of prescribers who were overprescribing benzodiazepines. This was even before the opioid epidemic. It was the precursor. And that is what kicked off the addiction epidemic. And so we were really trying to get the word out there and to create a national dialogue that substance abuse was an illness, that it required a public health response, that we needed to stop jailing people, and we needed to begin treating it through clinics. And that's how we got our first residential treatment center open. But over the years, equity changed what it meant for us, because we became more sophisticated. And as we developed more services and had to really learn how you manage them in a professional manner, not just by like blowing something up and saying, fund me. Or, I mean, literally the way we used to get funded was if somebody wanted us to stop protesting, they could fund us. And that's how we got our first grants. So eventually they gave us enough funding that we didn't have time to do that anymore. And we had to learn to manage the funding and how to run professional services. So now what equity means to us is really looking at data and figuring out what are people's actual needs, and also knowing what their perceived needs are, but what are their actual needs? How do we meet those needs? And how do we meet those needs in a manner that is acceptable to the people being served? I think one area where we still have a lot of work to do, and I keep trying, and I usually end up getting beat up every time, is I think we're not very good at reaching out to the tribes. There really is some discord, I think, in Rio Arriba between some of the local governments, city and county, and the tribal governments. And they're not necessarily accustomed to working with one another. So I have been making the effort to reach out to tribes to ask if they want to get to participate in some of our activities and grants. And we do have some people from San Ildefonso, Santa Clara, and Okayawingay who come to our health council meetings. But I think we could do much better at that, honestly. And that's kind of where we are now. Initially, when I was hired, there was just me. There was no department. We now have a department of about 20 different staff, and we've got some VISTA volunteers, and we're rapidly expanding. And so we're in 5 different locations, including the jail. We have jail diversion going on at every intercept point. And now we're really focusing also on vaccine equity. And so my latest project is reaching out to every single school district, including the Jicarilla Apache, and trying to help to coordinate DOH and local efforts to get all the children vaccinated, starting with 12 to 18 and then moving on to 5 to 11. And so that's what we're working on right now.
Wonderful. Thank you so much, Lauren. That one of the things that impacted me, there's some comments in the chat as you were talking too about some other states. Michelle Pacheco offered that some other states are focused on, they have task forces that focus on equity and COVID-19, continue to integrate equity and racial justice into their work, right? And as you were telling your story, right, how equity changes as you actually scale your council and its work. And it's one of the really important things to remember, even while it is important to have a definition, right, a sense of what equity is about, reminding ourselves that equity is dimensional. It looks different depending on where you're looking at a particular system or particular opportunity. It looks different for everyone. And so often we want to bring our understanding back to how do we develop, whether they are outreach strategies or actual systems for service delivery, or it's trying to understand what communities both need and want, that we're creating ways to do that meets each community and its membership where they are. So the access point is something that they can actually connect to, so that we can do exactly what you're talking about. You all have been doing, not only scaling, but staying mindful of how equity changes in terms of how it manifests. That I want to ask all of you to give a virtual thank you to both Enrique and to Lauren. So yeah, you can use the virtual claps or fiestas, or you can just do the sign language, like, yeah, happy, right? And I still do this as well.
Everett, could I throw one more point out there real quick?
Yes,
it's very quick.
I can't see who is.
Oh, that was Lauren.
Oh, Lauren, yes.
Sorry, yeah, and that's one of the things we're discovering now is because substance abuse has been for so long dealt with through the criminal justice system, it means we're really having to shift from a shame-based, I don't want to call it treatment modality, but something modality, corrections modality, to one that is based in fear and shame, to one that is based on empowerment and building confidence. And we're finding we have to change an awful lot of words. Like, for example, the latest thing is harm reduction, which means needle exchange, jail diversion, stuff like that. Well, for me, I really have a problem with that set of words because it implies that the individuals are so awful that the best we can hope for is that they'll stop harming people or themselves. Really, you would not have harm reduction for diabetes, you'd have a wellness program. And so we've got to really change how we look at it, what words we use, and looking at the ways in which we shame people and transform that into a means of helping people to change behavior because they feel confident and good about themselves.
Mm-hmm. Absolutely. That language and framing, right? The frames are so important because our narratives, our stories live within frames that get developed. And often frames are handed to folks as opposed to folks being able to develop their own frames to tell their own stories. Another part of the really important part of how we think about our connection to the work and to the folks doing the work. And I think both of you and both of your stories, one of the things I heard connecting them is just this idea, right? That the work that's happening and the folks who are doing it and how it's being done is reflective of the community itself, right? That there's another layer of kind of connection in how and who's doing the work. And I think that's really important. So I'm hoping after you all hearing those stories, and I know there's so many more, and I'm hoping that you all are feeling like you want to dig deeper into some of that storytelling, because what we're going to do next, we're going to give you a short stretch break, like a short 5-minute break here in a couple minutes, just so you can turn off your camera, stand up, stretch a little bit, maybe go grab some water or just run to the bathroom. But when we come back, we're yay breaks. There's a big thumbs up for breaks in the chat from Enrique. When we come back, we're gonna actually get you all into breakout sessions and give you an opportunity to really connect to each other and to have some discussion about how you might see this work going forward, right? In terms of, again, things that you all can talk about that you're already doing. And again, because we're asset oriented in our thinking, it's really important to know what you're doing that you feel like is a place that you can kind of leverage and move forward with. And then some discussion about what your needs are, right? In terms of being able to begin to fully engage your health equity work. And again, whether it is your whole council changing its name, like Bernalillo County did, or how you're scaling structure, like Rio Arriba, in terms of we may have a structure, a task force, we may have something as we scale that and talk about it in terms of equity, how we do that work. You may actually have an entity or a project or a committee already that is kind of focused on that work. And it might just make sense for that committee to become your health equity committee. And then if you're in a position where you've not done any of that work or not much of that work yet, then just begin to think about how do we develop that structure? How do we begin to put together a committee and develop a roster for that committee and a meeting schedule for it, and then centering it around its work around equity. And those are all parts of what can be part of your discussion when we come back from break. And when we do come back from break, Natalie will be leading us through the Jamboard session in the early afternoon, along with so many of our colleagues who are going to be working as supports as well for each of the Jamboard breakout sessions. So with that, it is 5 minutes till. I'm going to go ahead and say we can break, and that we'll see you all back here at 2 o'clock, and then we'll get started with our breakout sessions.
Okay. I hope everybody's back. It is now 2 o'clock, so hopefully you had a chance to stretch and maybe get a drink of water, get some coffee, wake up in the midday. My name is Natalie Pena, and I am so excited to work with each and every one of you. I'm new to this work, just so you know, but I have worked with the health councils and tobacco prevention, just to give you some background, and also have done a lot of equity work as well, and those dialogues, and how do we create equity within all of the domains that we're working in. So I think that was a really great, and what you did, and somebody speaking out to how we can actually include equity into all domains of what we're doing. Also, thank you for those who shared and reaching out for the call. I know it was kind of a very quick last minute thing. If somebody, I don't know if everybody's on mute. We could have everybody just mute there. Thank you, I appreciate it. But yes, thank you for Lauren and Enrique for actually, oh, I think we're still getting feedback. Can I just ask for people to mute if they're not on? I think if we could go in and mute those that are not muted, I think some people might still be awake. But yes, thank you. Thank you. I appreciate it. Okay, so I just want to thank you guys for sharing. I think that it's very important that we also hear from our peers, and I think some powerful statements were made in terms of equity and thinking about equity at all levels, right? From this conversations that we're having today even, and the decisions that we're making, and the decision makers down to the community and how they're involved. So super excited to be. With that, we are going to do something called jam boards. How many of you guys have actually engaged or done jam boards? If you could just raise your hands. I don't know if everybody has. Okay, see a couple of people. You guys can do a virtual thumbs up too, however you want to engage. So for those of you who have not done jam boards, we do send out a link, and I'm going to go ahead and share my screen just so you kind of see what a jam board looks like. You guys will be broken out into different groups, and somebody will help you facilitate the conversation. But what we're asking is that you guys participate how you feel comfortable. If you are not able to connect to the Jamboard, which you should be able to, then you can type in chat, and the person who's helping facilitate the group can write in on a sticky note what it is that you're saying. And that's just as a backup. You'll receive a link, and when you click on the link, this is what will come up. There's a couple of things that you can do. The main thing that we're focused on here is this sticky note. You're gonna click on the sticky note, and it's fun because you can change the colors if you'd like. So you can choose the color that you like, and then you are gonna type in there. And when you do, it'll show up on the board. Now, this is a tool that everybody engages in together at one time. So everybody's responses will show up on the Jamboard, and everybody can see what everybody's done. You can also move these around. You can, go like this. Definitely have fun with it. We want you guys to have fun in these rooms. And up here, you'll see what the question is. And these are the questions that will be asked by your facilitator. So what lessons have you learned, or what lessons from the field resonated with you? We'll go on to what would you need to have in place in order to build equity and capacity, and then also what additional supports you'll need. And so they'll basically be going over each one of those questions, and as they change, you have access to do the sticky note. There's other stuff on here that you can use, but we won't be using that today. And what we hope to do is just gather a bunch of information from you in terms of how you're feeling about this, and that way we can use it in the rest of the work that we're going to be doing with you as time goes on. So they have set up breakout sessions. Does anybody have any questions on how to utilize Jamboards? Okay, it seems like everybody's good. You guys will be put into breakout rooms, which was done nicely in the background as we were preparing for this. So if we want, we can go ahead and break out into our rooms. Remember, you'll get a link in the chat box. You should have your link in the chat box when you get to your room, and you'll click on that, and the Jamboard should show up for you. And then what you'll be using is the sticky note to respond to the questions. and you will have a facilitator supporting with that.
Natalie,
So,
I see Josephine had her hand raised. Did you have a question,
oh,
Josephine?
sorry.
No? Okay.
Oh, awesome. So if we want to break out, I think, was it?
Natalie, I could do that now. And then who's ever left in the main room, I'll go ahead and send them out to breakout rooms.
Sounds perfect.
Okay, great. Thank you.
Thank you so much.
Victoria has her hand up.
Yeah, Natalie, will we be returning at 2:40?
Oh,
Yes.
that was my question.
Yes. Yeah, we'll come back as a group right after that.
Geraldine, I didn't see the link to the Jamboard. Am I missing something?
Natalie mentioned she was going to post that, but I can double check with her right now.
Okay, thanks.
Mm. Josephine.
Jamie?
Yes, ma'am.
This is Evangeline Zamora. I just joined in. I'm not sure where we are right now, but so maybe we're done. I don't know.
No, hi, Evangeline. We're at the top of the second hour.
Okay.
There are breakout sessions that folks are going into right now. Okay. And Geraldine will be able to assign you to one of them. You'll spend about 40 minutes in there in a peer conversation answering 3 questions, and then we'll come back and debrief that. Okay, thank you. I'm in Arizona and I had an appointment, so I'm a little running behind, so I got kind of off track there. No problem. Thank you for still being able to participate. Oh, thank you. So do I just wait or do I join the Ann room? I got a little notice. If it's giving you a button to join, go ahead and join that one. Okay, yes. Thanks. Thank you. Perfect.
Okay,
I'll just hang back to answer questions if they're.
Okay, Everett, it looks like Natalie did not post the Jamboards. I can join her room and then get that information from her.
Yeah, I was going to say you don't have the link to them.
Oh, she did not send those. So let me. I'm checking my emails. Madeline was the one who was working on this and her internet completely shut down.
Oh gosh.
Well,
yes. if she's in a room, she has to see that nobody has a Jamboard, I'm guessing.
Let me broadcast a message.
I was getting ready to say that.
And I will post the discussion questions as well, just in case. Let me see if I can join her room.
Okay.
I
texted her. Now I'm trying to give her a call. Were you able to get it when you were in there?
She sent a Google Doc, so I'm gonna go in there and I'm gonna do individual. Oh, we need access. Oh,
Oh, damn. She said she sent it to Madeline like last week, the link or something.
ooh. Yeah, I have no access. Are you able to get access?
No, I don't have access. She was doing all this part of the agenda.
Okay.
Hang on.
Let me call Madeline.
Hi, Jalen. I just wanted to make sure I didn't miss an email with the Jamboard links. We're just visiting, so.
Okay, she posted it in the chat, but there's no access to them. So I'm gonna get in with her and make sure she provides access to the links.
Got it. Okay.
Okay, sorry, one sec.
No worries. Thank you.
Okay, so it looks like she's posting it in the chat. Oh goodness. Okay, maybe it gave people time to like introduce themselves and
Yeah, actually, do you want to broadcast a note to just tell people, yeah, just start having the conversation about what lessons from the field. They can have those conversations, and then once the Jamboard shows up, they can just document what they were talking about.
okay, yeah, I have the discussion questions posted.
Right.
So I'll do a broadcast.
Yeah, and just say, please go ahead and be in your discussions. And when the Jamboard link shows up, then you can capture what you've been talking about. That way they don't wait to talk, waiting for the Jamboard.
Okay.
Perfect. That's a perfect note. There's two people, Maria and Becky.
Okay, she said she was posting them. I don't see them anywhere.
And it could be because it's only posting to the room she's in. She needs to come back out here and post it. And then it'll go to everyone. So send her a note and see if you can pull her back over here. And then she can post it in the chat. It'll go to everyone. And then she can go back into the room she's in.
Okay, let me. There's no reply, so I'm going to go back into her breakout room again.
Okay. Yeah, but she's going to have to come out here, I think, to post it everywhere.
Hi.
Hey.
Okay.
Okay. Yeah. Post it in this chat.
Okay. So here's the Google Docs.
Okay. So that should have gone to everyone, I think.
Do you want me to go to is there a way for me to go from room to room?
I
don't know how to do
think
that.
so, but I think Geraldine might have to send you to room. But I think because she can broadcast messages and so forth. But this still should be fine, right? If people just started having their conversations, they can just document it now that the Jamboard shows up. You don't need the Jamboard to talk. Right?
Yeah. Right.
But so let's see. So is Geraldine coming back? Or
I told her to stay in that room so I could come figure out what was going on here.
no, that's it. It's just posted here and it should have showed up there. But you can't get back to that room, can you?
Yeah, I can. I could go back to the.
Can you? Okay,
yeah.
if you can go back to that room and check in with her or have her come back out, and then we can see if it showed up for everybody.
Okay.
It's all good. Did the link show up everywhere?
We didn't see it in our room, so I'm going to go into individual rooms and then make sure everyone has Jamboard.
You see it here though now in this chat where we are. It's right at the bottom. You don't see it?
No.
It's right. You should see it. I'm looking right at it.
Yeah, no, I don't see it, but I'm going to go into every room again and then make sure everyone has a Jamboard.
Okay.
Okay, so, okay.
Hold on. I'm going to post it one more time for you. Oh. Susie.
And Susan, okay.
Still needing to pop in and out?
Yeah.
Yeah. How many are there? 8 breakout? No. How many?
There's 7 today.
7.
Okay, I'm going back in. Sorry. Bye.
All right. No, go ahead. Okay. Hey, before you, last one?
Yeah, I got one
Go
more.
ahead. Go ahead. And then I think I'm going to extend the period so people have a little bit more time.
And we can broadcast that when I come back.
Yeah, that's what I was going to ask. But go ahead, go jump. Hi, Rosalie. That. Oh. Okay. You hit them all?
Yeah, I hit them all.
Great job. Oh my gosh. You were popping in and out and in and out. Did you have to go in and paste? You had to like copy and paste into each one you went into?
Yeah.
Oh,
I just did that. I was like, it's okay. I made sure everyone knew that we were having difficulties, but I'll go ahead and broadcast the message now.
So, hi, Lauren.
Hey, I need to be put back in my breakout room. I had to leave because the Jamboard stopped working for me.
Okay.
Let's see.
Thanks.
See, Lauren.
I'm in Susan's.
Okay. Move to Susan. Okay, so it looks like you're already there. So
I left it.
Already in the room. Is there a way if you can go to breakout room at the bottom and it says join?
Oh, okay.
And then you can click Susan W.
Okay.
Hey, oh, what happened to the other lady?
Looks like maybe she left.
Okay. So what do you think? Do you think, so they all have the Jamboards. There's 10 minutes on the time we had originally given, but I'm thinking at minimum to 245 instead of 240, but I'm actually thinking to 250. You think 245 or 250?
Well, in most of the rooms that I went in, they were already on the second question. They were just writing either on notes or they had created something completely different on a whiteboard.
Okay.
So maybe 245 is good.
Okay. I think that'll get, yeah, I agree. Okay, let's do 245 and that way we can still have a little debrief and a closing.
Okay. Would you, let's see. Breakout room. 245 p.m.
Okay, Adrian.
Oh, maybe he knew how to get back into his room.
Yeah, he might have, because he popped in here and then.
Oh yeah, he's back in there.
Perfect. Yeah. Okay.
Woo.
Oh man. So Madeline's everything just she lost all her tech, huh?
Yeah, she lost all her tech and I didn't have access to any of her documents.
Okay.
And then when I went in, it said Natalie's access was not granted.
Right. So Natalie sent it to Madeline, but Madeline's went down and no access was ever exchanged.
Yeah.
Hey, sometimes it happens, right? But at the end of the day, they all have their Jamboards and they should be able to record it all. We give them a little extra time. So nice work.
I know, it's good. I felt it was okay. I mean, everyone, they mostly used their time to introduce one another and they were kind of leaving off the first question. So
kind of waiting for the board to show up.
Yeah.
Well, I think, I think giving them a little bit extra time, and we can do a quick little debrief. Yeah, and I'm glad I hung back because, yeah, right. No, I know. Because I was thinking when you were like, can I put you in the breakout room? I was thinking, no, I better hang back because there's always people with questions. You show up late.
Yeah, and I didn't find Josephine, and it's a good thing I messaged you because when I saw her after you had messaged me.
Yeah, I told her, hey, raise your hand so you'll move to the front of the screen so Geraldine will see you.
Yeah. I'm going through each Jamboard and it looks like people are using it. So
awesome.
Yeah, they're using the Jamboard.
Good job.
Going to 4. Yeah, and there will be one Jamboard, which is mine. There will be nothing because I had to take over tech and I only created 7.
Okay.
Yeah, so, and I'll just let Natalie know, or you can pass the message along. Let's see.
Yeah, that there'll be one blank one?
Yeah, it'll be mine. I was supposed to facilitate one, but because of all this, I only.
Yeah, no, I'm glad you hung back. I mean, there should always be some people who hang back, right? For exactly this reason. And well, I guess we're in the main room, right? So, and they're all in their breakouts, which is fine. That way we can troubleshoot and whatnot.
Yeah. Cool. Everyone has used their Jamboard.
Right. Hey, cool. At the end of the day, still got, right?
Still got this is normally what I would do when Madeline, before she came as an executive assistant, I was running all the Zoom stuff. So I was glad she at least said, hey, I'm completely off internet. And I was like, okay, so we have to change some things around, which is fine.
Well, and I think Natalie sent the stuff so early, Thursday of last week.
Yeah, on the internal agenda, I was looking for the breakout rooms and the Jamboard stuff. So I mean, maybe another time if we use Jamboard, we'll have all the Jamboard links on the internal agenda.
Yeah, that might be a good idea. Well, and usually I think she assumed that when she mentioned the Jamboards will be posted, that
Madeline
was going to post them.
Oh man.
Yeah, so she was like, "Oh yeah, they'll get posted in the chat," and and kept on rolling. But it's a good thing you had been doing it before, so you knew how to move.
And I got all of the links by like a personal chat, so that's how I was able to access them.
That's what I thought happened, because once you go to a breakout room, right? If you put anything in the chat, it actually shows up in the, no, it doesn't show up anywhere, just in your chat, huh? And then it doesn't get saved, or yeah, only the main room chat does, right? Yeah.
Let's see. Okay, cool. 2:36.
Yeah. So 4 minutes, we'll give them the do you normally do like a 5-minute call and then a 1 minute?
I do 5 minute and then a 1 minute. So then when I close the breakout rooms, it'll say 60 seconds.
Yeah. So when you say 1 minute, they really got 2, right?
Yeah. Do you have any fun trick-or-treating?
You know, we took the girls to Old Town and they met a bunch of their friends and a few of the parents. And so my wife and I came back here. No one ever trick-or-treats on our street, right? Like that ever. And last night there was a group that came by and we didn't have candy. Well, we had some candy, but it was all like, full-size bars. Like, so they came to the gate and my wife was like, hold on. And she got full-size Hershey bars and full-size, and she was putting them in there and the kids were like, oh. They're like, this is the best house ever.
Oh.
It's like, man, we made out because we weren't ready to hand out any little tiny candies.
Oh yeah. We drove into the town. I live by Farmington, so I live on the outskirts. And it was my son's first Halloween, so he's gonna be a year on Saturday.
Oh wow.
Yeah, so it was cute. I mean, he didn't really understand what was happening, but he was just happy to be out and about.
Yeah. No, that's cool though. His first one, huh?
Yeah, he was Captain America.
Oh, right.
Yeah.
Yeah. Our girls are this, well, our daughter Sierra, she's a senior in high school. So the group of them, and then our daughter Sage is in 9th grade. So her and her 9th grade 2 friends kind of trail behind the seniors.
Oh. That's usually how it is.
Right. So I'm like, well, that's probably Sierra's last one, right? Be too old to trick or treat before long. They had fun though. They had a lot of fun. They were like, Dad, are you going to stay with us? I was like, no, the Cowboys playing. I got to go home and watch TV.
That was an awesome game. We were like jumping up and down in our room, like in our PJs. I was like, no way. And then at the end with Zeke, when he did that good run, and then I was like, oh.
I wasn't expecting it.
Let's see. Hey, Becky. Do you need to be? Oh, so she's connecting to audio.
Okay.
Yeah, that was great. I was not expecting that.
I was not either. I was like, what? They're not the same Cowboys, right? They make mistakes, but they overcome them now. They don't lose because of them.
Yeah.
And Dak wasn't playing. I was like, they're going to lose.
Yeah, that's what I thought. I shouldn't have thought that way, but I mean, the quarterback came in clutch.
But last year, right? Dak was hurt. They were terrible. And that dude that played last night, he was on the team last year, but he never played.
Hey, Becky.
Hi, Becky.
Did you move back to your room?
I'm having issues. I don't know what's going on. I keep getting knocked out. So I went in and then I left, and then I don't know what I'm doing here. So my phone, if you can hear me.
Yeah, we can hear you.
We can hear you.
Okay, let's see if I can get back in.
I can move you from my end if that makes it easier.
Yeah, I don't know what's going on with my part. Why is it keep telling me to leave?
Oh,
did she leave?
Yeah, it looks like she's back. Oh, she completely left.
Hi, Donna. Is she connecting back to her room?
Oh yeah, she's connecting to audio. Let's see. Let me do a 5-minute broadcast.
Okay.
Yeah. 5-minute warning. Yeah, that was a good game though. It was like a good way to end your Halloween.
Right? It was like, okay, like I hate Mondays anyway, but whenever the Cowboys win, the Monday is always a little better. Right?
Yeah. Yeah, my partner was yelling at the screen because of all those defensive flags and stuff from the.
Come on, like 2 of them weren't even things.
Against, was it Gregory 94?
Hi, Steve. Is he trying to get back to his room?
Let's see. It doesn't show him in any room.
Hi, Steve.
Yeah, I'm with DOH, and I had something come up, so I had to sneak out. But I believe we're coming back at 2:40, right?
Yeah, and actually we extended just to 3 or 4 minutes. So it'll be 2:45, but so we can put you back in your room just for the last 5 minutes or so.
Yeah, whatever works. I'm also fine hanging out here. I missed the first like 20 minutes of it or so. So.
Oh, right.
Yeah.
Well, if it's really up to you. Well, you might want to hear the end of what your group is talking about, because we'll do a little bit of a quick debrief when you come back. So I think Geraldine can put you in there pretty quickly.
Let's see. Oh, Steve, so you'll have to go to the breakout room at the bottom to rejoin.
Oh, I see it. Okay.
I thought she could move you.
Yeah, when they come out and they're already in a room, I can't move them back in.
Hi, Diana.
Hello.
we ended early, and I was just realizing I can't chat with people outside of my breakout room. So I was coming back to find Chris Hollis and give her a message, but I can email her. I'm tech savvy enough.
Debbie, okay.
Was Debbie in your group?
Oh yeah, looks like groups coming out.
On the way back.
Mm-hmm.
Right. Welcome back. We'll send a 1 minute countdown here in a second. Actually, it would be now, huh, Geraldine? Because it's, a minute, and then it gives it an extra 60 seconds. Hi, Joe.
Hi.
How are you?
Good.
Right on.
We got our jam board up, so we all came back.
Yeah, they. I think people got them a little late, but still, I'm hoping still had enough time to use them. Right, that people started their discussions, and then just as the jam board showed up, fill them in. Rashid, how you doing, man?
How are you doing?
All right, it's good to see you.
Long time.
I know it's been a long time. How are you?
Good to see you, brother.
Man, it's really good to see you. Hey, that one. All right, folks are coming back.
Sorry, Susan, I didn't put that last one in the jam board. I guess you'll have to write it in.
Yeah, I'm writing it as we speak.
Everybody got their jam boards? Yay!
Yeah, thank you. And Denny, if you could add what you were starting into our jam board, that would be great too.
We can leave these jam boards up if you guys have something you guys want to go add back in, and we can close them out, by Wednesday. If there's something that's super pressing for you to go add in, especially because there was some technical difficulties, which I do apologize for that. Technology, it doesn't always go as planned. But you guys, thanks for being patient and actually picking up where you could. So yes, it's amazing. Teamwork makes the dream work. So Everett, did you want to speak? Okay, go ahead.
Yeah, no, thank you. And thank you all for working through that. You can tell are pros, right? Because you all started your discussions, you did your intros, you started your discussions, the Jamboard showed up, you were able to fill them out. Perfect, nice work. And I just want to highlight, Geraldine was a master stroke of technological tap dancing. And we were in the little breakout room moving things around, but she was really moving some things around. So thank you, Geraldine. So we wanted to just extend the time a little bit so you could take a breath once the Jamboard showed up and have a little bit more time to talk. So we want to just do a quick, if there may be one or two folks who might like to share what your conversations were like. Just give us a sense of what you discussed and kind of what some of your thoughts were. Anybody have any thoughts they want to share from that breakout session? I'm looking through all three screens to see if I see any. Let's see.
I'll share, Everett.
Okay.
This is Michelle, and Maureen Schmidt was in our meeting, and she discussed a lot of the activities that Otero County Health Council has done. Okay. And she was basically saying that, as in many of our councils over the years, equity has been a part of their work. They just didn't call it, for example, equity committees or equity teams, but they did address equity. And she says, really, for the past 3 years especially, they've had quarterly 1-hour chats with a different topic, and they made it welcome. Everyone was welcome. And so of course they had different participants perhaps each time, but they were very intentional in providing resources, some neutral sort of data points, some neutral PowerPoints, and issues that would resonate with community members and talk about emerging issues. And for an example, she said what was helpful was recently they had the Asian Pacific Islander, the Heritage Month. And so that was a selected topic. And so they had a lot of resources, and this brought out a lot of discussion on what was happening on the national level and what was being reported out. Let's see. So the intentional actions was important for them to move forward and keep the discussion going, because it really brought about a basic awareness among the community. And then some of the challenges were that when it's not so prescribed and there's more flexible aspects to formulating an equity committee or an equity council, there are basic issues like access to internet, or basic questions like what are we doing, or how can we accommodate, and really what is involved in HB 137? What are they going to be held to account for? And I'm trying to look at, we did have some issues doing the Jamboard, I have to say, but I just jotted down some notes on and just some edited highlights.
Okay.
So
that feedback is perfect. And if you have a chance, if you want to drop some of that in the chat, if you feel like it didn't get captured on the Jamboard, please feel free to. But I think part of what you're reflecting is some of our discussion on this side is you all have been doing such good work for such a long time that the sensibility was you probably have been doing that work and hadn't called it a separate thing or had a separate task force for it. So really part of this session is helping us to understand how many of you have done that kind of work and what it looks like, and then how we maybe help to connect with you to figure out how do we give it maybe a little bit more structure, and then how it works in concert with the larger Health Council work, right? That it doesn't become something that pulls you away from your larger work, but it really does help to enhance and deepen that work. So it's complementary and hopefully doesn't outstrip the capacities that you have, because we understand, right, there are limited capacities, and always want to be mindful of that. So Michelle, thank you for sharing that. And I think, and Diana Good said, and social justice teeth.
Yeah, I'm wondering if Chris might want to share a few things from the group that we had.
Chris, did you want to? You had uncovered before, but I see you put your I'm
here.
Back on mute.
I shared a lot. I'm like, okay, what did I share? I shared a lot. No, we talked a lot about where we're coming at from our health councils, and just how we maybe how I think I talked about how we were missing the power discussion around power dynamics discussion earlier, from when we were talking about how Lauren went in with the community, and, you know, as a white woman and everything, and then with the Mexican board and everything too. You know, like we talk about it a little briefly about power dynamics, but we don't go deep into the conversation. Like, we're shy about it because there's money involved, there's relationships involved, there's a lot of other things involved. So sometimes we don't have those hard discussions about really holding the status quo accountable to, you know, how our communities are the way they are. And that's hard, you know, because we want to be positive people, and we, in public health and community health, we really think of, you know, trying to get people to better health equity. But part of that is healing too, as well. We don't talk about the healing as much sometimes, maybe too.
Yes,
Yeah.
Wonderful points, right? The power analysis, and we're always, right, thinking about how people exist across an ecosystem, but how systems also coexist, and the different centers of power within and throughout ecosystems, whether they're interpersonal power dynamics between people or people in a group, or there are institutional dynamics, a council with a larger system, right? There's always a need to have a good sense of where the power analysis is, right? And you're right.
Yeah. And then we talked about, sorry, I didn't want to talk over you.
No, go ahead.
We talked about how we needed more people, how our families are so busy with their lives, our students, everyone is so busy with their lives, that 40 hours a week, plus, all the downtime. You still have to schedule entertainment time and, all of that stuff. We're just too busy to get people civically involved in a lot of our projects. And that starts at, what kind of, world are we living in, and what kind of work are we doing that makes people work so hard. And then also the need for resources and like workshops to have like trainings on, just capacity building within the community for facilitation, leadership development, advocacy, all of those routes. But again, we hit that problem of, those people don't have the time to get into these workshops. We can have them in the mid-afternoon, we can have them at night, we can have them on the weekends, but we're always missing a large part of chunks of the community that just can't get involved because they have their own lives too, and they only have their work lives too. So something has to break there. Something in society has to break there to help people get more civically involved. We don't have marches that are giant anymore, maybe because are proportional to our population because everyone is so busy. Could you imagine if we had a march that was proportional to the March in Washington, and today that would be a lot bigger than any of the marches we've had so far. I think the only thing in comparison is probably the Egyptian was it the Arab Spring, or no, not Arab Spring, the Egyptian uprising a couple years back. But yeah, we were talking about some of those needs of just really trying to get people involved and, really building the equity conversation with the community and building from there.
Yes. No, thank you for that. And even in the chat, some folks left some other comments in terms of safety and support when health councils are addressing equity. Equity issues haven't had space or knowledge, right, to really kind of do some of that work. And Marilyn pointed out that we've all kind of been doing equity work. The flip side, right, there are always two sides of a coin. We say we're doing equity work. The flip side is we're actually trying to mitigate some of those power dynamics that you all are talking about, right? So equity work is very much about mitigating inequitable dynamics. And that's another way to think about when we're centering equity, we're decentering something else. And the things we're trying to decenter are the inequitable dynamics that you all are speaking about. So this is why it's so incredibly important that we're in discussion with you all to understand the work you're doing and how you've been doing it. And then we can really try to figure out where can we be supportive as you continue on the journey? Where can we be supportive? Going back to something Lauren talked about, how can we scale equity, right? If you've been doing it, how do we scale your structure such that you scale the equity work and we never forget that it's dimensional? And access equity is one of those huge places that we got to constantly think about, given what Christopher was just saying, right? With all of the competing things that people have, that is life. How do we create access so the voices that are necessary to be in those discussions can be in those discussions? So we're 3 minutes from, I just want to say a little bit about what for Natalie and I and the core team, part of what we're going to be doing, Natalie and I, after this is reaching out to each one. We'll take all of this data from the Jamboards and see what folks we're talking about in terms of what connects. And yeah, Samantha, I really like the idea of scaling equity, starting small and building continually so it isn't overwhelming. Yes, I think that's really our goal, is how do we help support you scaling and it doesn't become overwhelming. That's a perfect way to say it. And that is part of what we'll be doing is thinking of the best ways to reach out to each of you and get a sense of where you are and what could be helpful based on the information you've already given in the Jamboards and in some follow-up discussions. And so I want to thank you all for being with us today, hanging in through some of our COVID technological gymnastics, but luckily they're real pros around the screen and in the background and connected to this work. Really happy that that is the case. Oh, and Lauren put another, and I think it's become dangerous to engage with your community. We need to develop a safety framework for ourselves. So another important thought, right? Both internally and externally, the sensibility around there's physical safety, but there's also psychic safety, right? Psychological safety, being in groups. That's a really important dimension to all of the work that we're talking about. So with that, I want to say thank you. And I'll ask Sharon if she has any final thoughts before we let you all go to complete your Monday at the start of another week. Sharon?
Well, I just want to thank our health councils. It would be real easy to say, this is something I have to do, check out, and not really participate. But you were deeply engaged. We were able to learn from your experience, and that required making yourselves vulnerable to each other and to Everett and Natalie that you're just meeting. And so I want to tell you how much I appreciate you being willing to be vulnerable and to share. And thanks to Everett and Natalie for coming into a new group and doing such a good job of connecting with us. And I'm just really looking forward to where we go from here. Thanks.
Thank you all so much. Thank you. Have a wonderful rest of your Monday, and we'll see you again soon.
Thank you.
Thank you.
It was a
Bye.
great meeting. Thank you.
Great. It was great.
Thank you.
Thank you.
Thanks, everyone. Bye. Have a good day.
You too. We'll see you, Kristen.
Bye.
Bye.
There he is.
Yeah. He came on camera.
Yes. Hi, Debbie.
And then, Geraldine, I think you, did you say you had?
So I didn't start the